Welcome back to my YouTube thing. I am Allison Gomez. I am a licensed marriage and family therapist in California. I primarily do individual therapy and group therapy for high achieving women of color who are coping with, thoughts of, like the dark thoughts, like suicidal thoughts, meaning isolation, responsibilities in life, as well as those who are like coping with like those super high expectations and learning how to let some of them go, because that is such a pain. Just disclaimer that this is not therapy. While I am a therapist and I can ask very good deepening questions, like ones that make you feel a little called out, this isn't therapy. If you would like to work with me and you're in the state of California, you can go to the link in my details, whatever caption thing, and click on that, and you can get more information about some of the work that I do, individual and group, and schedule your free consult. If that's not in the state of California or I'm not your jam, then you can go to like therapy directory sites like Therapist Den or Inclusive Therapist. Now, here is, just before we get started, I am going to mention that this talk is going to be involving suicide. So if you're in a space where you don't feel safe to listen to that, then this is a good way to back out. Now, if you are experiencing a mental health crisis, you can always call the National Suicide Prevention Lifeline at 1-800-273-8255. If it's an immediate crisis where you need help like right now, call 911. But today I wanted to go over something that I feel like a lot of people don't know how to navigate. Like, it's something that's really intimidating, and it's suicide. And this is intimidating to both therapists and to clients because obviously it involves death, and one, we're very scared of death, but also like in terms of liability or the fear of being locked up. So I'm going to kind of demystify that a little bit for you, because if those are thoughts that you're having and you do feel safe with your therapist, then it might be worthwhile sharing that with them. So let's talk about what suicide really is, or at least suicidal thoughts. And this is specifically just to suicidal thoughts. What they are just thoughts of wanting to die, thoughts of death. There's different levels of what that looks like. For some people, it's very, very what we call like passive, where it's like you get up in the morning and just kind of wish that you didn't wake up. Like you're not actively going to do anything. It's just like, it would be better if I wasn't here. Like things would stop, or I get some relief. Versus something more active, which is coming up with a plan, thinking of the means, and really preparing. Like this, something that there's a lot of energy kind of going behind. Passive, not so much. It's just maybe a feeling, a thought that pops up every once in a while. Active, you're actively doing something. And that does make a difference in therapy. So like as a therapist, we are mandated to make sure that we keep you safe to the best of our abilities. Obviously, we are not like almighty powerful people who can keep you in like the safe little bubble for all time. But within our, I guess, like due diligence, we have to make sure that we're doing what we can to keep you safe. So if you're having suicidal thoughts, we want to make sure that you have a safety plan. Like, who are you going to reach out to if it gets too overwhelming? How are you going to get to a hospital if you need to, and whatnot? So that's something to know. And here's another thing to know. Not all therapists are very competent in working with people who have suicidal thoughts. You think that they would, because we do all this training, we get all this education, we get the, guidance, but that is not necessarily the case. Some therapists are very not good at it, and they believe a lot of myths about suicide. Like, for instance, I once went to a therapist who told me that if you truly love someone, you'll never die by suicide, which is false, because suicide has nothing to do with whether or not you love people, like at all. Having social connections can help decrease that risk of you dying by suicide, but death by suicide does not involve love at all. Suicide is usually a symptom of something else that's going on. And so there's no moral reason. There's no like moral judgment when it comes to suicide. It's about pain and the pain that you're in and wanting that pain to end. And so when you bring it up in therapy, that's really going to be the focus. The issue isn't that you're actually suicidal. It's what's leading up to you feeling like there's no way out. So when you bring up suicide in therapy, or if you call a crisis line, because this is a little bit similar, your therapist is probably going to ask some questions about what type of thoughts, where are you in terms of like, that energy, that motivation to act on it. Are you intending on doing something with this, or is it just thought? Do you have means? Because one of the things about suicide is that it can be very impulsive, and they've done studies of this over in the UK, where a lot of people were dying by suicide, I think with like certain pesticides. And so when they made it more difficult for people to access those pesticides, the rate of suicide decreased. So it's very much when you're in the middle of that crisis and you're trying to find a way to make it stop, it's easier to do that if the things are around. So you don't get a chance to work through the crisis. It just kind of stops. So a therapist is going to make sure, like, okay, how do we make sure that you're going to be safe? Because it's really hard to do therapy if you're dead or in the hospital. So they might go over something like a safety plan. If you're like getting an assessment, they're definitely going to do over a safety plan. It's going to feel a little forced, but just know that it's to help keep you safe. But another thing is if your therapist is really competent with suicide, working with suicide, then they're also going to help you like explore what's really going on. They're not going to try to shove it. They're not just going to try to cover their butt. They're going to give you that space to really talk about the heaviness of whatever it is that's going on in your life where you're getting to this point. And that's it. I mean, it's not as intimidating. It feels really intimidating because there's this idea of, if I share this, what if something bad happens to me? And so for the therapists who aren't as well trained in this, they might suggest, okay, you should go to the hospital. But to therapists who know that, hey, this is like, some people just have chronic suicidal thoughts. Like when they get stressed out, they just pop up. It's not like a big deal. It's just more like evidence of something going on. Maybe, just like maybe there's some vulnerability. So you want to make sure, if this is something that is happening in your life, to ask when you're consulting with therapists to, kind of feel them out, ask about it. Like, hey, what is your experience with like working with suicidal clients? What trainings have you taken? Or, how do you treat it? Like, what do you do to make sure that you're honoring the therapeutic relationship and not just trying to cover your butt? Because I've also like had colleagues who did focus on just covering their butts. And it's a balancing act. There's no guarantees in therapy, and it makes it really uncomfortable. But if you're with the right person and you're able to vet it, it doesn't have to be as scary and as intimidating as it appears. And it can be a really good space where you can relieve some of that pressure because of the stigmas that come around with suicide. I mean, they're pretty heavy, and it doesn't leave much room for you to chat about it because, there can be a lot of judgment from people, and it's scary. So I hope that this was helpful in terms of how to navigate it. Let's just kind of do a quick recap. One, your therapist is probably going to ask some questions just to assess for safety. And two, if they're really competent, they'll give you the space to talk about it. If they're not, they're going to try to problem solve it away. And that is a big red flag. And if you're not able to work through that, you might need to find another therapist. Anyhow, I hope this was helpful. You have a lovely rest of your whatever time. Until next time.